Imagine waking up tomorrow in a world without antibiotics, where surgeries are a brutal ordeal, and the secrets of our DNA remain locked away. Shocking, right? In today's dive into the annals of history, we're journeying through the top 10 revolutionary medical discoveries that transformed that bleak past into our present. These aren't just facts, they're the pivotal moments that redefined health, life, and even the essence of humanity. So buckle up, because we're about to unravel the tales of audacious experiments, serendipitous observations, and relentless pursuits that changed everything. Ready? Number 1. Discovery of penicillin. In the confines of St. Mary's Hospital in London, 1928, a seemingly ordinary day took a turn for the extraordinary when Dr. Alexander Fleming stumbled upon something that would change the course of medical history. He observed a petri dish with Staphylococcus bacteria, which had been unintentionally contaminated with mold. To his astonishment, the mold, later identified as Penicillium notidum, was killing the bacteria around it. This accidental discovery was the birth of penicillin, the world's first antibiotic. Before this, even minor infections could be fatal. The power of penicillin was so immense that it revolutionized medicine. It promised a cure for various bacterial infections and diseases that had plagued humanity for centuries. Fleming's accidental experiment ushered in the antibiotic era, transforming medical science and saving countless lives. The global impact of penicillin cannot be overstated. During World War II, it reduced the number of deaths due to bacterial infections. It wasn't just a discovery, it was a beacon of hope in the bleakest times. While resistance and overuse are concerns today, the initial boon of antibiotics altered the very nature of disease treatment. Number 2. The Human Genome Project. In 1990, a colossal endeavor began that would span a decade, encompassing the efforts of scientists from around the world. Their objective? To map all the genes present in human DNA. Known as the Human Genome Project, or HGP, this ambitious initiative aimed to determine the sequence of chemical base pairs that make up our DNA, identifying and mapping all of the genes of the human genome. The sheer scale of this project was unprecedented. Imagine understanding the very code of life, a sequence over 3 billion base pairs long. The knowledge gained from this endeavor has proven invaluable. By identifying genes linked to certain diseases, researchers can now develop targeted treatments, understanding illnesses at a genetic level. By 2003, the HGP was completed, giving scientists the tools to delve deeper into the complexities of human biology. This enormous database has facilitated breakthroughs in precision medicine, where treatments can be tailored to individuals. It's akin to possessing a detailed map of an uncharted territory, a map of ourselves, offering insights into diseases, ancestry, and the very essence of our being. Number 3. X-rays, peering into the unknown. One can only imagine the incredulity of Wilhelm Conrad Röntgen's peers in 1895 when he unveiled a machine that could literally see through solid matter. When working with cathode rays, Röntgen discovered a new type of ray that could pass through most substances and render bones visible on photographic plates. He aptly named them X-rays, with X symbolizing the unknown. It's fascinating to think that a serendipitous observation of fluorescent light from a screen placed near his experiments led Röntgen to a revelation. The first ever X-ray was of his wife's hand, revealing her bones and wedding ring. The potential of this technology in medicine was instantly recognized. No longer would doctors have to operate just based on external symptoms. They could actually see inside a patient without making a single incision. In the years that followed, the X-ray machine underwent numerous refinements, becoming a staple in medical facilities worldwide. Its applications have expanded, aiding in everything from detecting fractures and tumors to guiding intricate surgeries. Truly, X-rays bridged the gap between external symptoms and internal ailments, making the invisible visible. Number 4. Vaccination, the power of prevention. Long before the concepts of germs and immunity were established, a man named Edward Jenner made an observation. He noticed that milkmaids who contracted cowpox seemed immune to the deadly smallpox. In 1796, armed with this knowledge, Jenner tested a groundbreaking hypothesis. He took a material from a cowpox sore and introduced it into a young boy. Later, when he exposed the boy to smallpox, there was no infection. The first vaccine was born. Imagine a world where deadly diseases could be preemptively combated, not after they struck, but before. This was the promise of vaccination. The principle is elegant in its simplicity. Introduce a weakened or inactive form of a pathogen to the body, prompting an immune response without causing the disease. The impact of vaccines on global health is profound. From eradicating diseases like smallpox to controlling outbreaks of measles, polio, and influenza, vaccines have saved millions, if not billions, of lives. They represent one of the most cost-effective public health interventions, turning once feared deadly diseases into preventable ones. Number 5. The discovery of insulin. The early 1920s bore witness to a groundbreaking discovery in the University of Toronto's labs. A team led by Frederick Banting and Charles Best identified a pancreatic extract that regulated blood sugar. They named it insulin. Before this discovery, a diagnosis of type 1 diabetes was a death sentence, with sufferers often wasting away. It's hard to fathom the hopelessness diabetics felt, with no cure or effective treatment in sight. But insulin changed everything. By introducing purified insulin into the body, sugar metabolism was restored to near normalcy. This wasn't just a treatment. For many, it was a miracle, transforming a lethal condition into a manageable one. Today, insulin therapy is a lifesaver for millions of diabetics globally. The story of its discovery reminds us of the profound impact research can have on individual lives, turning despair into hope and reinforcing our faith in the relentless pursuit of medical innovation. Number 6. Anesthesia. The end of surgical agony. Picture a world where even minor surgeries were excruciating, where patients dreaded the scalpel more for the pain than the procedure. This was the reality until the mid-19th century. The introduction of anesthesia, compounds like ether and chloroform, were nothing short of revolutionary. They numbed pain, allowing for more intricate and lengthy surgeries. It's said that the first successful public demonstration of surgery using ether in 1846 was met with a profound statement from a witnessing surgeon. "Gentlemen, this is no humbug." The relief anesthesia brought was immeasurable. The mere thought of undergoing a surgery without it sends shivers down the spine. The development of anesthesia allowed surgeons to perform with precision, unburdened by the patient's pain and distress. It expanded the horizons of what was medically possible, paving the way for transparent surgeries, intricate heart procedures, and countless other medical marvels we often take for granted today. Number 7. The birth control pill. In the 1950s, a revolution in reproductive health was brewing, leading to the birth of the contraceptive pill. This wasn't just about preventing unwanted pregnancies, it was about giving women control, autonomy over their bodies and destinies. Pioneered by scientists like Gregory Pincus and John Rock, with the support of activist Margaret Sanger, the pill became a symbol of the women's liberation movement. The implications of the pill were vast and multidimensional. Beyond the obvious health benefits, it played a role in reshaping societal norms, granting women greater freedom in planning their careers and families. It's astounding to consider how a tiny pill could influence the dynamics of gender roles and expectations. The ripple effect of the contraceptive pill's introduction has been felt in various spheres, from public health to socio-cultural landscapes. Its legacy is a testament to how medical innovations can transcend beyond health, impacting social structures and individual freedoms. Number 8. The stethoscope. Amplifying the beat of life. In 1816, French physician René Laennec faced a predicament. He needed to ascertain heart sounds of a female patient, but was uncomfortable placing his ear on her chest. His solution was ingenious. He rolled a sheet of paper into a tube, creating the prototype of the stethoscope. This simple instrument amplified internal sounds, allowing for clearer auditory examination. The stethoscope might seem rudimentary compared to modern imaging devices, but its contribution to clinical medicine is paramount. For the first time, doctors could listen to the symphony of the body, the lub-dub of the heart, the rhythmic inflow and outflow of breath. This was diagnostic empowerment in its purest form. Today, the stethoscope is emblematic of the medical profession. Beyond its diagnostic utility, it represents the intimate connection between the physician and patient, a bridge between the healer and the ailing. and remains a timeless tool in the doctor's arsenal. Number 9. Germ theory. Unmasking invisible killers. Before the 19th century, the prevalent belief was that diseases were caused by miasma, or bad air. The true culprits, microscopic pathogens, remained hidden. But scientists like Louis Pasteur and Robert Koch were about to change that. Through meticulous research, they unveiled the role of germs in causing diseases, birthing the germ theory of disease. It's a game changer to realize that tiny organisms, invisible to the naked eye, were responsible for some of humanity's deadliest adversaries. From tuberculosis to cholera, the invisible had names, forms, and characteristics. This understanding laid the foundation for sterilization, pasteurization, and a host of antiseptic practices. Thanks to the germ theory, medicine's approach to disease prevention and treatment underwent a paradigm shift. The emphasis on hygiene, the development of vaccines, and the introduction of antibiotics can all trace their roots back to this fundamental understanding of the microscopic world's role in health and disease. Number 10. Organ transplants. Gifting a second chance. The 20th century witnessed a marvel that seemed straight out of science fiction, replacing a failing organ with a healthy one. The concept was staggering. Could life, or at least a semblance of it, be extended through such a procedure? In 1954, the first successful kidney transplant between identical twins provided a resounding yes. Imagine the hope this instilled in countless patients with organ failures, the promise of a renewed life. However, the path wasn't without challenges. Rejection of the donor organ by the recipient's body posed significant hurdles. But with advancements in immunosuppressive drugs and surgical techniques, organ transplantation became a beacon of hope for many. Today, from hearts to livers and lungs, organ transplants save and improve lives daily. It's a testament to human ingenuity and the indomitable spirit to overcome the seemingly impossible, redefining the boundaries of life itself. And there we have it, folks. A whirlwind journey through medicine's most groundbreaking moments. But remember, while we've come a long way, the future still holds mysteries waiting to be unraveled. So keep that curiosity alive, and until next time, stay healthy and never stop exploring.